Hello, and welcome back to Sharing a Chapter a Day. This is Do Ra Mi, and today I will be reading Chapter 2 of Engagement in Peril by Dara Ado Sup. Chapter 2 God's Bloody Punishment. Then I was back at the residence that I was staying at. I once lived in a room in the basement where I mostly kept to myself. Once home, I got on my personal computer, got online, and checked my email for jobs and important notification. I spent the rest of the night playing Literary Online and watched streaming anime show and program that I currently follow. I am an avid fan of Naruto, Bleach, and One Piece. I have been following their weekly episode posting for over several years now. For some reason, on and during this particular evening, I was feeling a wee bit tired. More tired than usual. I thought nothing of it at first. After several hours of viewing videos and being online, I took my prescribed medication of statin, niacin, and baby aspirin. And then I turned down for slumber that cold evening around 2200 hour, several hours earlier than my usual bedtime. Falling asleep was no problem for me. I fell fast asleep. And then all of a sudden, around 2300, I awoke with some discomfort in my abdomen and stomach, and had to use a restroom rather quickly then. In pitch darkness, except for the blinking red light from my digital alarm clock, I leaped out of bed and headed out of my room, several feet away toward the basement bathroom. Once I arrived to the entrance of the bathroom, I turned on the left side wall light and proceeded to defecate my first bloody stool that night. There was no problem pooping out the liquefied bloody stool. I squirted and squirmed for several long minutes until I felt that I was done and felt better. With a handful of double-ply Kirkland toilet paper back away from my bottom, I wiped my anus clean and pulled up my pajama trouser, washed my hands, and went back to bed that eerie, lonesome night. Once back in my room, I once again fell fast asleep. And then, an hour later, once again, with the same slight stomach discomfort, I went about my way to use the restroom once again. And again I pooped out bloody diarrhea. I thought nothing of it. I noticed that it was quite dark and had a taint bloody smell to it. I'm quite familiar with blood and how it smells. After all, I used to work with the United States Navy as a combat corpsman, and have had my fair share of blood up to my knees and elbow. After defecating the bloody pool of dark coffee grain wet stool, I cleaned my anus and hands and went back to bed once again. From then on, for the next several hours until 0700 the next Sunday morning, I was routinely awakened by the same discomfort and continued to have bloody diarrhea. During one of my many bloody wet poop that morning, I thought it may have been my recent diagnosis of diabetes that was getting to me. I have been told that I have early signs of type 2 diabetes, and is currently active by my primary provider at the VA hospital. From the look of my face and body, my skin was climbing to the touch and I was having dry sweat. So I snacked on some miniature Kit Kat bar that I had lying around in my room to help me with the lightheadedness and physical change that early morning. I had thought that that's what I needed to make me feel better. Also, during one of my mini diuretic complications that morning, I had fainted for about 20 minutes onto the cold bathroom tile floor. I think it was during the 0400 hour bloody squirt that I had collapsed. I remember that I was still shitting out the bloody soggy stool, and once I stood up to pull my pajama trouser up, I was getting really lightheaded and couldn't hold myself up to prevent the deliberate fall. In my head, I was telling myself, get a hold of yourself, Dara. Make sure to catch a fall. But I wasn't able to even do that. I had fallen and smacked my face and head onto the cold tile floor without the world noticing. I was out cold for a while. I think I hadn't bothered to call out for help or could even yell for help if I had any kind. After several long minutes on the sword cold floor, I finally awoke from the sudden faint spell. I took several deep breaths. With my eyes wide open and realizing what had just happened to me, I told myself to push myself up, and slowly I stood up while pulling and pushing myself up against the bathroom dividing walls for support. Once I managed my weak body to stand astute, I paced my step toward the bathroom sink, turned on the sink's water faucet, and with cold water, I washed my hands and face, and took a deep gulp of the sink tap water into my throat from my cupped hand to help with my dry mouth. I thought I was just thirsty or something. Little did I know that I was dehydrated from all the blood that I had recently lost through my mini constant diarrhea that morning. After washing up, I slowly dragged myself back to my bedroom and once again fell asleep with some lightheadedness still pounding in my often suicidal head. Around 0600 that morning, I had the same abdominal pain and discomfort and had to use the restroom once again. I quickly and carefully thrust myself up from my bed, hoping that I hadn't stained the bedsheet and covered it with my runny, bloody stool. I quickly maneuvered myself in the dark toward the bathroom once again. Once at my final destination, I flicked on the light and dropped my pajama trouser halfway toward the commode. I once again squirted and squirted out gooey, wet, soggy, bloody, coffee grain stool into the toilet's bowl, which have now become accustomed to my smooth, tan ass. I was again on the porcelain bowl for a good few minutes, a little weaker physically and much more dizzy than previously. I managed to wipe my ass clean and proceed to stand up. Once I stood up, I had the urge to throw up, something that I haven't done in over a decade. Luckily, I was in front of the commode, and with an about face, I quickly turned myself around and chucked up the same substance that had been coming out of my anus and ass. I was throwing up bloody black fluids and feces into the toilet bowl below. I was practically shitting from my mouth. I hadn't realized then that I may have a medical emergency on my hand, like my stupid, ignorant self, so I didn't bother seeking help and proceeded to go back to bed that airy, cold Sunday morning. I once again ignored my immediate medical emergency. After washing up and getting myself in somewhat control, I dragged myself back to bed. Once I collapsed onto my bed, I was really hurting in my head from the constant painful pounding. It was like steam were blowing itself out of my ear. I was telling myself to calm down and sleep it off. Dara, get a hold of yourself. Just relax your mind and thoughts and sleep it off. So I stupidly told my ignorant self that early morning. But this time, I wasn't able to put myself in check. I was thinking to tell myself to drive myself to the VA hospital, the emergency room, of course. But I was barely able to lift myself up from bed and let alone drive a 2-ton vehicle to the VA hospital that was about a good 30 minutes away on the freeway. This wasn't the first time I had to go to the ER. I'm quite familiar with that aspect. I had previously had some close call as well when I was infected with MRSA several years back, and that minor angina I had back in my heyday as a combat corpsman for the United States Navy. I finally decided to get help. Since it was a Sunday morning, I know that the entire household was still fast asleep since they would be going to Satan's church to worship several hours later that morning, like they routinely do on Sunday morning. So I need not bother them, and since I hardly talked to them about anything or about what was going on with me, I shunned them. I shunned that thought about asking for help from them. I shunned that thought to bother them from their restful, sinful slumber. I awoke the only person that I can trust and casually talk to in that house. I went several doors down to Vuta's room, who was also in the basement, and I woke him up and asked him to drive me to the VA hospital. I pushed his closet room door open and asked calmly, Hey Bill, get up. Can you drive me to the VA hospital? I may have an emergency here." I beckoned him up from his sleep and stooped. He didn't bother asking me any question why. He quickly gathered his belongings and got himself freshened up in the bathroom. While he was doing that, I returned to my room, gathered my belongings, ripped open my orange backpack, grabbed my keys, laptop, and some notes, put on a pair of old used comfy blue jeans, put on my white wife beater and my black Stanford middle school sweatshirt, and left my room. Locked it and walked toward the stair and waited for Vuta to finish his preparation to drive me to the VA emergency room. Once we were both ready, he helped me up the stairs and out into the street where his refurbished purple Jeep Cherokee awaits. He helped me into his SUV. I threw my backpack into the foot space below, and we drove off to the VA hospital without anyone in the house knowing of what just happened to me that moment ago in their home while they were all sound asleep. While Vuta drove me to my final destination, to the VA emergency, I asked and advised him not to tell anyone in the house of what had just happened to me and where I was going. I just simply didn't want them to know what my critical medical emergency was. I simply told him that I was really lightheaded and what had happened since 2300 last night. Vuta didn't ask, and I drove onward. Luckily, it was a Sunday morning and the freeway traffic was light. We had no trouble traveling at the posted freeway speed limit, and we had very few stoplights that held us back while on the way there. Once we exited the I-70 east and arrived onto Colorado Boulevard, I instructed him to hook a left and to head southbound, and then I advised him to take a left at 12th Street, and then right and a right turn at Claremont Street, and then another right at 9th Street, and then into the VA hospital emergency room entrance. He did as I asked and patiently listened to my pleas and requests of him that eerie morning. Once we arrived to the ER, I thanked Vuta for driving me there and handed him $20 for gas and for his trouble driving me there that morning. And with my packed belongings in my weak grip, I exited his vehicle and made my way toward my deathbed in the ER. I walked myself into the VA emergency room waiting area through the sensor electronic double door. Once inside the glass brick building, I waved goodbye to Vuta through the tinted large glass window while he drove off out of my sight and back home to finish his slumber. And I then quickly made my way to the check-in window. Luckily, there was no one else waiting in the often packed emergency room waiting area that Sunday morning. I told the attending clerk of my medical problem, handed him my VA membership card, and waited for the triage nurse to attend to my needs. I was advised to take a seat while he gave me my paperwork in order. I found a seat and waited a few minutes until the triage nurse called me into the vital sign room and began to triage me of my medical emergency. While taking and recording my present vital sign, the nurse and I talked about my complication, issues, history, and discomfort that morning, and what I had gone through, and of my medical history. ER nurse triage notes. Triage. Suggestive of patient complaint. I have been having black diarrhea and vomited the same thing. Patient report diarrhea every hour since 2230 last PM. Black liquid. Patient report vomited black liquid this AM. Triage level. ESI 3. Age 33. Sex male. Vital sign. Temperature 98.2 Fahrenheit. Pulse 120 beat per minute. Respiration 18 breaths per minute. Blood pressure 110/61. Weight 170.8 pounds. Pulse oximetry 97 room air. Pain level 1. Exam young male in no distress. Head, eyes, ear, neck and throat. Question slight. Icterus. Neck supple. Cardia tachycardic. Lung CTA, abdominal soft, no tender, no rebound, no guarding. Rectal, brown black stool, no blood noted, a good tone. Neuro, non-focal. Once the nurse was done with her triage, I waited for several more minutes, and shortly after I was escorted into the emergency treatment room. Once in the secure room, there were several rows of gurneys and makeshift treatment spaces. I was advised to undress and put on a hospital gown. I was also given several plastic bags to put my belongings into for safekeeping. After I had made myself comfortable and was under the sheet atop the gurney, the ER's doctor came and introduced herself and asked me a few more questions. The usual. How are you feeling? And how are you going to hurt yourself in this matter? And are you going to hurt yourself afterward? Since I had a history of suicidal attempt, psychological problem, and such, and while I was on active duty with the US Navy, she wanted to make sure I wasn't going to kill myself or do myself off like some other patients have done in the past. After our initial and proper introduction, I was once again placed on several monitors to record my vital sign. It's no fun what happened afterward. It wasn't the first time, nor will it be the last. The ER doctor put on a pair of clean gloves and stuck her index finger up my ass, up in my anus to get a fecal matter for testing to see if I was really shitting out blood. I gave out a shout of discomfort when she stuck that non-lubricated finger up my tight anus. The slight pain was sharp and quick. I relaxed afterward once she had pulled out the intruding finger. With some fecal sample on her finger, she applied it to a fecal strip and sent it off for testing at the pathology department. She advised me to get comfortable on the gurney and went about to check on her other ER patient, who were all much older than me. They were senior citizens who are going through various emergencies and complications, much different than that of my medical emergency that near death early Sunday morning. Courses in the ER. 2 large bore line obtained. Negative with lavage. Brown liquid obtained. Sent to lab. Type and screen ×4. 2 liter normal saline bolus given. GI medicine called. Occult blood positive. Gastro-occult positive. HCT 43.4. Last HCT August 11, 2010. 51.8. Platelet 141. Assessment and plan. Upper GI bleed. Tachycardic with failing HCT, but blood pressure still maintaining. Call GI medicine. Admitted to ICU. Fluids Type and screen obtained. Chief complaint, GI bleed. I have reviewed the RN triage note for this visit and have reconciled my discrepancy. History of present illness and review of system. 33-year-old male present stating he had black stool and black vomiting starting last night. Patient state that he also passed out while in the bathroom this AM. Pulse in triage is 120. Patient denies alcohol or history of ulcer. Patient had never had this history before. Patient denies abdominal pain. Allergy? No known drug allergies. Patient medical history. See below. Problem list. 1. High cholesterol since 19. 2. Alopecia. 3. Resolve after Kenalog injections. 4. Positive PPD several years ago. 5. Personality disorder, NOS adjustment disorder. 6. Health maintenance. 7. MRSA, MRSA. 8. Perirectal abscesses. 9. Type 2 diabetes, unspecified. Allergies. Patient has answered, no known allergy. Patient brought in for history of noting black stool last night at 2300 hour, and then patient. And per patient every hour after that. Patient also stated that he vomited some black emesis at 0600. Patient denies any other vomiting. CP, SOB, nausea at this time. Heart palpitation, but denies any at this time. Patient has bowel tone in all 4 quadrants. Abdomen soft and non-distended, tender. Ambulate independently without the use of supportive device. At 0745, patient to bed number 2. Patient care Zoom. At 0750, 18 gauge IV insert time. 1 attempt to patient left forearm. Patient blood drawn and heplock connected. At 0755, 18 gauge IV insert time. 1 attempt to patient right forearm. Heplock connected. At 0810, 18 frame tube inserted. 1 attempt. Placement verified by auscultation, aspiration of stomach content. 0830, nose tube irrigated with 500 cc of normal saline until clear. Patient blood pressure 104/61. 120 respiration. 1 liter of normal saline hung. 0900, 2 liter hung to patient right arm, IV, with some nausea. Patient is aware. Patient is medicated as ordered with Zofran, 8 mg IV. Blood pressure 115/71, respiration 109. At 0930, patient blood pressure 106/64. Pulse 112. Blood redrawn for type and screen recheck. Patient has urinated 450 cc's. At 10:00 a.m., blood pressure 106/59. Pulse 108. At 10:15, patient has urinated 425 cc of urine. At 10:20, patient sent to X-ray via stretcher and portable monitor, then to SICU. Patient care transferred. In SICU, AP, 33-year-old Cambodian male with history of DM, HLD, depression, on 162 ASA Q day here with upper GI bleed. Most likely cause of bleeding at this time would likely be duodenal ulcer versus gastric ulcer versus gastritis. Very unlikely mass in this young patient. Likely ulcer combination of NSAID plus positive H. pylori with history of resident in Cambodia. Did have fairly significant UGI bleed with decrease in H&H and initially hemodynamic change with episode. Currently with no active blood on NG lavage and no active bowel movement. Melena for last 6 hours. Likely has stopped active bleeding. Two large bore IVs. Will need semi-urgent endoscopy. Will hold for now as not actively bleeding. Plan likely for tomorrow if stable overnight and able to transfer for GI lab for scope in the morning. If any evidence of change in hemodynamic, would consider scope emergently today. Please call for any change. Avoid all NSAIDs. GI initial inpatient consultation. Reason for consult: melena and coffee ground emesis. Patient history: 33-year-old Cambodian gentleman, history of diet control, DM, HLD, here with 1 day of melena, coffee ground emesis. Began the evening prior to admission at around 11:30 p.m. Noted 6 bout of black tarry stool over the 6 hour that evening until 6 a.m. Felt lightheadedness, dizziness with diarrhea bowel movement. Did have a faint episode at approximately 4 a.m. Had black emesis at 6 a.m. Drove to emergency department to be evaluated. Associated mild at max 5/10 pain. Still with some abdominal pain but subside down to 2 level. No prior similar history. Denies any history of ulcer-like pain. An ER department note to be tachycardic to 120. Normal blood pressure. Lavage with some minimal fresh blood and coffee ground. Clear with 500 cc. Has no further bowel movement over the last 6 hours. While lying there in the emergency room and being hooked to several monitors and having a tube stuck down and through my nostril down toward my stomach, I managed to call mother in Long Beach and told her what had happened to me and that it may be my last time talking to her. I wanted to say goodbye and tell her that I love her. I told mom what had happened since last night and what I did or didn't do, and that I didn't bother telling the household that I was staying at that I was really, really hurting here. I told mom that I really miss her and that she shouldn't worry too much about me. I was here like this once before, several years back. So that's what I had told her. I just didn't want her to worry too much. Little did I know that she would call and tell those bastardly Christians in that household what I was going through. I wanted them to stay out of my situation. And even after I had requested her not to say anything, mom did the opposite. I guess mom was really scared for me then, and wanted to make sure that those were supposed to look after me be aware of my dire situation. I just didn't want them to know where I was or what was happening to me. They were the type of people who just didn't care or would just blame me for being sick. They were the kind to take advantage of you and use you. And when they get what they want, they throw you to the side. You know. The mother of that household that I was staying at, well, she had the audacity to call me while I was being tended to in the ER room and blame me for my illness. And not telling them what was going on. She blamed me for that. After several minutes talking to my mom, we said our goodbyes and I laid back firmly onto my makeshift bed and thought about my past lives, relations, and mistake, and trials, events, and adventure that led me to this agonizing point. I close my eyes, rapidly rummaging through my memories and thoughts about the last 34 plus years of my life. Clear as day I remember how it all started. Since Shin-Shin's passing, I too have been stricken with much illness. Maybe it's from the guilt of his death, and maybe it was God's punishment. His God is punishing me for my sins against him, against his true believer. I guess I am reaping what I sow. Not just my physical health has taken for the worse, my mental state as well has gone to the dark side. I'm being treated for various mental defects, anger, depression, to paranoia. Those are some of the diagnoses that the VA has determined for my state of being. With all the prescribed drugs and medication I'm on, well, I'm surprised I haven't conformed to being a mushroom and or being a basket case. What have I become? I just simply have to live on for the sake of Shin-Shin, for Shin-Shin's Igami. I must live on for his memory and live on because it is what he had wanted for me. It is acceptance that I have come to, and assurance. Before anything else tragic happened, allow me to say this. I have never been a good Christian, let alone a good human being. I have sinned more than the usual Christians, and more than most of the general public. And this is what I have come to realize. When one person dies, he disappears, along with his past, current lifestyle, and his future. Those who die have goals and dreams, but everyone has something as important as those as well, like parents, siblings, friends, lovers, people who are important to you while you are living. And for those I have been blessed with while I was living. While enduring my now so often close to death moments again, I began to question God and what is it all about? Here's what I have to say that morning while I was bleeding from my upper and my lower gastrointestinal tract. God, you are supposed to be a benevolent God, but you are vague. You are unknowable. You are unreliable. You let good people suffer and lousy people prosper. You took Shin-Shin from me, and what's next? What's up with that, God? All I've been going through as of late is in this hellish vortex. You're just straight out inscrutable, God. What do you want? What's the purpose for all this? It seemed I put my foot down that morning with God Almighty, of course. This is the end of chapter 2 of Engagement in Peril. Be on the lookout for chapter 3, which is called Birth of Chaos. Until next time, this is Do Ra Mi, and I'll see you later. Thank you.